Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I am Arnika from Universitas Muhammadiyah Gombong, and here I want to present my research. It is about psychological change and stigma experienced by family with COVID-19. First, the outline is first background, second, the methodology, third, the result, fourth, the discussion, and five, the conclusion. First, the background and the purpose of this research. At March 220, COVID-19 declared as a national disaster by the government of Indonesia, and at the Kebumen Regency, Central Java, we have red zone. We are in fourth level of COVID-19 disaster. There is so much patient with COVID-19, and the characteristic of the COVID-19 that highly contagious virus affect to the people. People feel fear, look negatively, and avoid interaction with patient with COVID-19 and with the family. So the family experience a psychological change and stigma. This is the methodology of the research. We have the design of the research is qualitative research with phenomenological approach. The sample, we use novel sampling technique. We take the caregiver of COVID-19 patient and we get the 10 participants for the data saturation. The location of the research is in Kebumen Regency, and we take the first participant from PKU Muhammadiyah Gombong Hospital. It is the caregiver of COVID-19 patient that treat at PKU Muhammadiyah Gombong Hospital. PKU Muhammadiyah Gombong Hospital was a reference hospital for COVID-19 patient at the Kebumen Regency. The data collection, we use in-depth interview with a semi-structured question, and then the data analysis, we use structured approach from Stefik, Lacy, and Kin that consists of 7 steps. The result of the research, we get 3 themes. And the first theme is about psychological change. And here we have 3 sub-themes. First, the psychological disorders, that the caregiver of COVID-19 experience a psychological disorder such as anxiety, depression, stress, and mood disorder. Then the second sub-theme was the adaptation process. The caregiver of COVID-19 patient, they have an adaptation process from the denial process, the anger, the bargaining, depression, and the acceptance process. And the third sub-theme, the caregiver of COVID-19 patient experience stigma. They feel isolated and people around them avoid them when they meet. The second theme is the condition during illness and treatment. First sub-theme is early treatment. People, the caregiver of patient with COVID-19 get isolated themselves in the home after they know that the member of the family was COVID-19 patient. Second, the activities during illness. The caregiver of COVID-19 patient in the home get an activity such as watching TV, reading novel, cooking, doing exercises in the morning, and other activity to waste their time. And the third subterm was the meaning of illness. They feel it is a common disease that they have to do with it. The third term was accepted support system. The support system that they get is first from the family and friends. Their family, their big family, and their friends get support them in the social media and sometimes from the telephone, in the WhatsApp group, and etc. And then from the community support them from the government of the village, from the neighbor, and people around their house. The discussion of this research, first from Sriong et al. 220, that people with COVID-19 and the family experience anxiety 6.33% until 60.9%. They feel depression 14.6% until 48.3%. Post-traumatic syndrome 7% until 53.8%. Psychological burden 34.43% until 38%, and stress 8.1% until 81.9%. This is the psychological change that experienced by the caregiver of COVID-19 patient. And then the next research from Yuan et al. 221, the caregiver of COVID-19 patient, they experience stigma generally, and especially at social rejection, unsafe financial, internalized shame, and social isolation. This is the stigma that they experience from the people around them. Then the next research from Elmag 220 about the activities during the isolation process for the caregiver. Exercise offers many benefits. It is good for the caregiver to do the exercise because exercise offers many benefits such as boosting the immune system, improving the bone health, and reducing the risk of heart disease, diabetes mellitus, and other threatening disease. And then it's about the meaning of the disease. It's about the spirituality and religiosity effect to get mean of the disease. Coppola et al. At 221 says that previous research suggests that spirituality and religiosity practice related to the mental and psychical health. That mental and psychical health for the COVID-19 and the caregiver, it depends on the spirituality and the religiosity practice. And the last one, at Shin et al. 221, the previous research on family support for employees during a pandemic has shown that family support has a positive longitudinal effect on work outcomes for employees during a pandemic. So it is proved that the support that the caregiver get from the community, from the family, and from the friends, it's effect for their health and its effect on their work, on their psychological mental health. Last one, the conclusion of this research was there are significant psychological changes the adaptation process is going through, and some are stigmatized. The healthcare provider must be able to assess the psychological condition and adaptation process experienced by caregiver of the COVID-19 patient so that the nursing care process can take place holistically, including biopsychosocial spiritual aspect. Thank you, that's all from me. And wassalamualaikum warahmatullahi wabarakatuh.